So, Jim?
Jim, you're on mute.
Okay, great. Thank you. Actually, I was going to start with Deena and have some introductions, and Deena then talk a little bit about the overall summer and her impression on the 2019 session. So, Deena, you can take off.
Thank you, Jim. Well, good afternoon, everybody. Thank you so much for joining us. You know, this was a great year to be at the State House, although it was a rather quiet year all the way around. The 2019 General Assembly came to a close earlier in April. Rather, it was later in April. Nonetheless, it was a rather uneventful year. It was rather quiet. We saw the Speaker of the House, Brian Bosma, keep everybody in check on the House side. Everybody seemed to move with intent and with focus. And Senator Bray and Lieutenant Governor Crouch kept everybody moving forward in the Senate side. All in all, I can report, Jim, with a big smile on my face, that there was not a lot of antics in the hallways, and there was not a lot of blustery conversation on the floors. So we did see a number of bills related to healthcare move through. I don't know how terribly exciting any of them were, but nonetheless, we're going to cover many of those for you today, and I'm excited to be here, and I thank everybody for participating. Jim?
Great. Thanks, Deena. Just a few thoughts that came to my mind as you were talking. First of all, for shameless plug purposes, we always like to publicize any upcoming RHA events that are coming up. Our big one is obviously the annual conference coming up in June down at French Lick. June 18th and 19th. We have our leadership seminar in Plainfield on August 22nd. And we're also hosting a webinar on May 22nd on cybersecurity. And any of you that watched 60 Minutes a couple of weeks ago saw a segment on the cyber attack that occurred with Hancock Regional Hospital in Greenfield, Indiana. The CEO of that hospital, Steve Long, will recount the steps that his hospital took in responding to that cyber attack. And he was a prominent feature on 60 Minutes a couple weeks ago, and I think you'll find that session on May 22nd fascinating about cybersecurity and the impact that has on healthcare. The segment was more than just about healthcare, but it was very prominent about the events that occurred at Hancock Regional in 2015. Just a few overall thoughts before I get to some specific bills. Once again, the Republicans had a supermajority in both chambers, 40-10 in the Senate and 67-32 in the House. There was some significant changes this year in the leadership in both chambers. Deena mentioned Senator Bray, Roderick Bray from Martinsville, is the new president pro tem of the Senate. Essentially, he's the leader of the Senate. And then on the House side, due to an unfortunate accident occurred involving Dr. Tim Brown, who's from Crawfordsville, he was injured very severely in a motorcycle accident up in Michigan last year. He had been the chairman and was actually co-chairman of the Ways and Means Committee, which is the architect of the biennial budget for the state of Indiana. He was assisted this year by Todd Houston, who is from Fishers, Indiana, and the Ways and Means Committee is the starting point for the annual budget or for the biennial budget that has to go through the General Assembly. So that was a pretty significant change in the House in the budget process. On the Senate side, Ryan Mishler, who's from Bremen, Indiana, up in Marshall County, was the chairman of the Appropriations Committee. He's his first time pushing the budget through the Senate after Luke Kinley had served in that position for many years, the senator from Noblesville, who had retired from the General Assembly. So that was a pretty significant change in leadership that would have affected the overall process, particularly on the budget side. So we're going to look at a few major bills here. If I can pull this up. And Allie, how do I get to my desktop?
You have to hover your mouse at the bottom of the screen there, Jim.
Over share, okay.
And click share.
Okay. And where do I get my list of items from my desktop?
You just click whichever screen you want, screen 1 or screen 2, and then have your list up on the screen.
Let's see. Why am I not getting it?
Jim, I have mine up if you need me to pull mine.
Yeah, why don't you go ahead and do that, Deena? What I sent you, that would be helpful. I apologize.
No, you're fine. Can you go ahead and close your share down so that I can grab that for us?
Yes. Did I do it?
Don't believe so. Hey, there's Jim Miller with a big fish in a kayak.
Yeah, that's true.
Deena, you should be able to click share and it will ask whether you want to stop the other person's share.
It is not, Allie.
Oh boy, I've really messed things up. I apologize. Okay.
Try now, Deena.
All right.
Sorry about that, folks.
You're fine, Jim. Are you guys seeing my Indiana General Assembly page, or are you seeing my Bill Watch page?
Bill Watch.
The Bill Watch.
Excellent.
Good. That's what we wanted, right?
That is what we wanted.
Okay, good. Thanks, Deena. Thanks, I'm glad you're technically sound, and you and Allie are. On this bill, what I call a Bill Watch, it's kind of this is kind of an abridged digest of a multi-page spreadsheet that I compile every year for showing action of various bills that have gone through the General Assembly. And if you look at your chat function, I sent a chat right at the outset of my email address, jmiller@indianarha.org. You can get a copy of this abridged version, or I can send you the whole enchilada that's about 17, 18 pages that list basically all the bills that were of interest that I followed throughout the entire session. Now, this was the long session running through the end of April. Next year's session will be the short session, which will end in the middle of March. So there were a significant number of bills that were introduced this year. In the House, there were 600 in the House. I was looking at the Senate. In the House, there were 710 bills that were introduced. 163, or 23%, were actually enacted or passed and signed by the governor. On the Senate side, there were 639 bills that were introduced, and 130 of those passed and were enacted, totaling 20.3%. So you can see approximately about a fifth of the bills that are introduced actually go through the entire process and end up being signed by the governor. The bills that start in one chamber and move to the other, taking action in one chamber and moving on, is approximately 30%. So even though the Republicans dominate the General Assembly, not all the bills that are introduced, even by some of the Republicans, make it all the way to the governor's desk. The bills that I thought drew most attention this year, and Deena, by any means, hop in here as I'm going through this list. I have about 10 that I feel that were or topics that were of particular interest in this particular session. Clearly, the adoption of the biennial budget, that's the only constitutional requirement the General Assembly has, that they must adopt a budget every 2 years. And under Indiana's Constitution, there has to be a budget that does not have a deficit. So that's always a challenge, particularly when the revenue forecast for the state of Indiana came out late in the session and indicated that tax revenues for the state were expected to be about $130 million less than what was expected. They were successful in passing the budget to the tune of approximately $34.6 billion for 2 years and maintain an approximate $2 billion rainy day fund for future use. Now, that rainy day fund is always a bone of contention and discussion during the General Assembly. The Republicans want to make sure that that rainy day fund is used in case there's a significant downturn in the economy, to be able to fund programs accordingly. On the Democrat side, they like to use some of that rainy day fund to fund specific programs and projects that they believe have more of immediate need than saving the money for a rainy day fund. It's just a difference in political perspectives. Some of the Democrats had proposed using some of that $2 billion to increase funding for teacher salaries. And in fact, the budget did have some, as we'll see in a few minutes, did have some significant increases for school funding, but it wasn't necessarily earmarked specifically for teacher funds. The money that was appropriated, the additional money that was appropriated for schools this year, the local school districts were given more discretion at the local level of how they wanted to fund additional payments for teachers or hikes in teacher salaries, as opposed to being mandated by the General Assembly itself.
Jim, I am going to jump in here really quickly. And you noted that Indiana has got a nice little monetary bag set off to the side that we consider reserves. Indiana is only one of 3 states that actually executes their budget in the black. That says a lot about how intentional our legislative body has been about making sure that they are very mindful of how and where our monies are spent. To give you an idea of how close to home that actually hits, the state of Illinois executes their budget in the red. And I'm sure if you spoke to many of the physicians who are providing care to Medicaid-dependent individuals, they will share with you that about August, they stopped receiving payments from the state of Illinois because they no longer have money. And I'm sure that if you talk to the folks here in Indiana, while they are certainly not getting rich off of their Medicaid patients, at least they are receiving payments all 12 months for those that they are providing care for. Okay, Jim, I'm going to hand it back to you.
Okay, thanks, Deena. Interesting that you mentioned about the governance and the budget safety net that the state has. There was just recently a report released by U.S. News and World Report ranking the various states for livability. And Indiana, I think, was somewhere in the area of between 35 and 40. And a lot of that had to do with some concerns about environmental issues, some of our health issues, including obesity, the propensity for Hoosiers to smoke. Some of those health factors brought Indiana's ranking of livability down considerably. One of the ones on the positive side, the state was ranked 6th overall in terms of financial stability and ranked very high in opportunity for business. So from a business perspective and from a financial securities perspective, Indiana does very well. From those others that we mentioned just a second ago, Indiana ranks very low. Okay, moving on. Deena made a comment earlier about the session being relatively quiet. There were a couple of issues that drew some pretty significant attention at the beginning of the session, and I think that the legislative leaders were smart in addressing these issues early so that it wouldn't create problems near the session's end in adopting a budget and getting some of the final pieces of legislation through. Most notably was the bias or so-called hate crimes bill that legislation that passed earlier in the session. This was a pretty controversial piece, being that Indiana was one of the few states in the country that did not have specific statutes on the books on how to deal with crimes that are committed in conjunction with bias or hate crimes. There was quite a bit of support for this legislation at the outset from the business community and some of the large employers as a means to help recruit prospective employees to the state that may have felt less than interesting coming to Indiana because of the lack of laws on the book regarding hate crimes. There was a significant list of those who would fall into, or categories of folks that would fall into the list of folks that could be considered vulnerable populations under the hate crimes bill. The final version did pass with some notable admissions on gender. The big one was on gender, and it did pass the governor's desk near the end of or early in the session, so they could address other issues. And we'll look at some of those as we go through the bill digest in just a little bit. There was some action on limiting the access for abortion in the state of Indiana. Certainly not to the extent that you're hearing in the state of Alabama, which just adopted some legislation that was very restrictive in limiting abortions in the state of Alabama, with one legislator even stating that they would like to have it challenged in courts so it eventually end up in the Supreme Court as a possible means to overturn Roe versus Wade. This action that's taken place in Alabama, there was also some action in Texas, some pretty aggressive anti-abortion bills. Some people or some critics of these bills are claiming that it may be some type of retaliation, somewhat of a retaliation to the Me Too movement. Whether that's true or not, and you can speculate all you want on that, but nonetheless, there is quite a bit of activity nationwide on some abortion rights. Indiana had some lesser aggressive action that took place on abortions, but nonetheless, a bill did pass, as we'll see in a little bit. There was quite a bit of discussion and work towards school and school bus safety as a result of the school events and the shootings, potential shootings that occurred not only in Noblesville but also in Richmond, Indiana, and school bus safety as a result of the tragic accident occurred in Rochester, Indiana, and we'll look at that in a little bit. Extension of gaming in the state. If you followed along, there was a gaming company that operated 2 casinos up in Gary, Indiana. They wanted to move one of the ship-bound or water-bound casinos inland to a very high traffic area in Lake County, and then sell the license to the other one to a group that's wanting to open a casino in the Terre Haute area. There was quite a bit of discussion and concern about how that might impact the other casinos in southern Indiana, but nonetheless, that particular extension of gaming did occur. And it also had to do with sports gaming that will also be allowed in all 50 states as a result of some Supreme Court action that occurred in 2018. The General Assembly, of course, continued its efforts in trying to battle the opiate epidemic, and we'll see some of that, and there's significant legislation that was considered, or extension of efforts to battle the opiate crisis. There was discussion regarding cannabis and some of the CBD-related legislation, and I think the fact that there were hearings on medical marijuana, the fact that there were even discussions that took place in some of the committees, I think is somewhat remarkable, because in the past, so those bills really didn't even get a hearing. And on a side note, some of the CBD, which is a therapeutic medication that does not have the THC component in recreational marijuana, there was actually a store that, in driving down Michigan Road the other day, I noticed that there's a new store that sells CBD products on the Boone-Hamilton County line. And if a CBD store can open on the Hamilton County, Boone County line, which are traditionally very conservative counties, you can see that there is significant progress in the state toward consideration of that as a possible therapeutic means. And then the final thing I'd like to talk about before we look at some of the individual bills is the legislative results versus the governor's so-called pillars or his actions for 2019. Those five involved the economy, which there are some concerns about. At some point, our bullish economy will turn bearish. If you noticed the other day, there was a significant drop of almost 600 points on the Dow in response to the U.S.-China trade war over some of the tariffs. There is concern that maybe we could be heading into a more bearish economy here in 2019 and 2020. If there's a turn down in the economy, will the rainy day fund and maintaining the rainy day fund and the financial stability for the state, will that be appropriate? And is that part of the governor's good government programs, where he's looking at ways to streamline and improve the operational efforts of the state government for its citizens? There's some of his other pillars have to do with infrastructure, workforce development, and public health in general, with a particular emphasis on the opiate crisis. Dean, anything you'd like to add at this point before we look at some of the individual bills?
No, I think that just to reiterate, Jim, it was certainly an interesting session. Everything that you noted certainly took center stage. And I noticed that we got a comment with regards to CBD products being sold across the state. You are correct in your sentiment, Kathy. However, there are still some pretty substantial concerns about the fact that there is no grading system for them. There is no way to identify, other than just by, a simple statement that they are all organic, or that there is nothing within them. There's no challenges. There's not been really extensive research within that product arena. And while many people are seeing some very positive results from the use of CBD products, don't think that just because there has been a law passed that they can be utilized, that there's not still much consideration and deliberation behind the scenes about how to make sure consumers around the state of Indiana are getting exactly what they bargained for, and making sure that there is no adverse effect by those who are consuming. So yes, you're correct in your sentiment, but it's still very, very rigorous discussion being had.
Okay, thanks, Deena. And at this point, I'd like to look at the screen that she has shared. And Deena, you'll have to kind of scroll down since you've got control of the screen.
Sure. Which bill would you like to go to first, Jim?
Well, I think right at the top, we're looking at some of the Senate bills. And these are, and looking across your screen, on the left column, you'll see a number. That's the number of the bill that was originally introduced. The next column is a very brief description of what that bill is about. The third column is the author, the original bill, what committee it started in this case in the Senate, the action that took place in that committee, how it looked, the fifth column or the F column, what it did in that particular Senate or that particular chamber. When it moved over to the next chamber, in this case the House, the committee that it went to, the committee action, the House committee that took action on that, the full floor of the House, and then the governor's action on when he signed or took action on that particular bill. And then finally, in the far right column is just a description of that, a very brief description of what that particular piece of legislation was about. So at the top, you'll see that I mentioned earlier there was concerns raised about school bus safety as a result of the accident up at Rochester. You can see that was Senate Bill 2, school bus safety. It was introduced by Senator Head, started in the Judiciary Committee in the Senate, passed that committee unanimously on February 6th, passed the Senate unanimously on the 18th of February, moved to the Courts and Criminal Code in the House, passed it 9-3 on 3/13, passed the entire House unanimously 88-0 on March 25th, and the governor signed the bill on May 1st. And then you can see that it's now Public Law 144, which will take effect as of July 1st. And any new changes or any bills that are passed will take effect July 1st unless there's an emergency provision that is part of the legislation and signed by the governor. So the next one, Deena, I'd like for you to talk about the ones that specifically IRHA had either support or opposed. The next one is Senate 33.
Sure. So the last few years, we have seen Senator Jim Merritt be our champion, all things opioid and heroin related. This year was no different. He came loaded to bear with some initiatives that looked more at recovery, and that's exactly what Senate Bill 33 did. As Jim noted, it started in the Health and Provider Services on the Senate floor, how it passed through with relative ease, then went to the House side and was heard in Public Health Committee, again, passed with ease. Public Law 145 was signed into law on May the 1st by the governor, and it was going to establish comprehensive addiction recovery grant programs. And as I understand this, they are looking to establish 3 different regions across the state where these monies can be allocated to bring resources to individuals who are dealing with and wanting to address their addiction, specifically around the opioid and heroin. But I do not believe that they are going to be limited exclusively to those.
Okay, thank you, Deena. How about scroll down to 198? Okay, that's the one that's highlighted in yellow. This was a pretty significant bill regarding well, it started out, let's put it this way, it started out as a bill to address controlled substances, but it was amended and merged with another Senate bill, and was retooled as sentencing. And this eventually became the hate crimes bill. It added all the language with the exception of some of the groups that I mentioned earlier that had been excluded. The big one was gender, as a list of groups that would be, or the judges could exercise additional penalties for crimes that were committed against specific groups that were listed in that legislation, gender being the one big exception. And as you can see, it had fairly significant support in the, it started with significant support in the Senate, got through the Senate, and then it ran into some opposition in the House, but yet it still passed 34-14, basically along party lines. And the governor signed this on April 3rd. You can see he did this earlier, as I mentioned earlier in the session, so that other attention could be focused on pressing matters that had to be done to finish and meet the legislative calendar of meeting the session's adjournment date of April 29th. Deena, anything you'd like to add about the hate crimes bill?
I don't think so, Jim. I think that I, along with others, are optimistic that as Indiana and our legislative body continues to evolve, that we will potentially see a review in a couple of years of that language, and possibly it become more inclusive and provide protections for all those of us who live and work and love our Hoosier state.
Okay, good. Thank you. You skipped right down to where I wanted to go. You must be reading my mind. 394 was a pretty significant piece of legislation and went through the Senate with fairly good support, and it got to the House and it failed in third reading. It didn't get to the floor. It passed committee but did not get to the floor for a vote, so it could move on for even conference committee and for the governor's consideration. This would have expanded the prescriptive authority for advanced practice nurses. Obviously, there are groups that would have lobbied against that particular bill, most notably the ISMA, the State Medical Association. But it did not get a reading on get a third reading. Therefore, it did not get a vote on the floor of the House, and that bill died as a result. Similar on 437, the school-based services and Medicaid. Right now, school-based services are fairly limited for Medicaid coverage in a school clinic-based setting. This bill would have allowed for increased services to be billed in a school-based setting. Right now, it's generally only allowed, services are only allowed in what are called IEP services, which have to do for students that have developmentally disabled patient or students. This bill would have allowed for an expansion of services in school-based clinics, but here again, it did not move in the House after it had support in the Senate. Deena, you want to talk a little bit about broadband development?
Sure. This one, of course, is actually very near and dear to IRHA. As many of you know, our own Allie Orwig executes some work with regards to an FCC program to continue and keep moving forward the broadband efforts in and across the state of Indiana. This bill was introduced in the Senate by Mesmer with co-sponsors of Houchen and Lysing. And it was, it moved with ease, as you can see, through the voting process. It then went to the House side and through the Utilities, Energy, and Telecommunications Committee. Again, passed with ease. And what it ultimately does is redefines or provides an official definition of broadband being a public utility to be included so that providers of internet protocol services actually have a little bit more weight, if you will. This is something, Allie, I know you're still with us. I can see you on the screen. this is something that has been a real bone of contention, because when it came time for running broadband lines, people really like to point fingers and say, you can, you can't, you might, we want you to, but there's a problem. We're not really sure how to address it. And there's right of ways, and it was kind of a mess, actually, as to whether or not it could be established and laid. And now that it is, quote unquote, a public utility, it is official that it has every right of way as much as your electric utility lines do. We were happy to see this one move through.
And how about our friend, the next one, with the certificate of need?
Sure. So this one was really when I saw it on the docket, I was like, why would we want to do this? What bird got in whose ear? And this is just basically recognizing, or it tried to recognize, a certificate of need for hospitals. And I think that this really came out of the micro hospitals that we saw popping up around the 465 dial. We saw a number, I think that there were 5 of them that popped up in rather short order here 2 years ago. And they really wanted to establish a program and be administered by the Department of Health that set forth certain requirements. The only challenge that I see with that is, we as constituents have got some great hospitals established. Many of them critical access hospitals and PPS hospitals here in rural. And I think that as moving forward, that it really, as communities and as economic development evolves, this is more of an urban-based challenge and not a rural challenge. And I truly believe that that is one of the reasons why it died, because we are very conscientious as rural individuals, as when people start to provide and erect various entities in our communities. And I don't think that we would see that happen. So, Jim, any insight on that yourself?
Well, I think you hit the nail on the head when you mentioned about the micro hospitals. I think, Senator Ruckelshaus is north side of Indianapolis, and I think the legislation probably was prompted by Ascension St. V's original plans to build another micro hospital up in southern Hamilton County. And it's my speculation that that's what created this bill or prompted this bill, although certificate of need is something that has been discussed and bannered about in the state of Indiana for a number of years, and I guarantee you will probably be back on the docket next year.
Yeah, it wouldn't surprise me either. Okay, can we move on, Jim?
Certainly. Should be, yeah, there we go. In big, bold, and yellow is House Bill 1001, which is the budget, and it's always 1001. Here again, this is the one piece of legislation that the General Assembly had to pass during this particular session. The only thing that they're required under the Constitution to do. And you can see if you go across, starting in the Ways and Means Committee, we talked about the difficulties with Dr. Brown being injured in the accident, with Representative Houston taking essentially the leadership in Ways and Means to get this legislation underway. If you go across, you can see that the votes pretty much fell along party lines, which is no surprise with Republicans having a super majority. You can see where there was obviously some opposition to the budget as it was originally, and then finally agreed to as in conference committee. And there's a fairly good summary of what the budget consists of. And I mentioned $34.3 billion for the 2-year budget, which will run through 2021. There's discussion in there about, in that particular column under the commentary, talking about the increased monies for education, for the Division of Child Services as a result of some concerns of the inadequacy of DCS's performance and the lack of caseworkers to be able to keep track of what's going on in protecting Indiana's children. There's just a fairly good discussion in there, that's brief, that talks a little bit about school funding and the how much money was going to go for schools, which represents a slightly less than half of the state's budget goes for schools. About a third goes for Medicaid and healthcare issues, and then the balance is left for infrastructure, corrections, good government, all that type of stuff that goes into the budget. So your synopsis of what was in the budget would be in the commentary on the right side. Deena, anything you'd like to add?
No, just that I'm glad that budget years are only every 2. This seems to always be a pretty overwhelming focus during budget years. And I feel pretty strongly that the legislative body does a much better job focusing on things when it's not a budget year.
All right. How about we move down to 1007, and you can talk about that, perinatal care.
Sure. So this one was definitely a bill that was near and dear to the heart of IRHA. Some of you may or may not be aware, there was a grant award that is being executed by Cindy Large, Heather, and Jonah, and I just lost her last name. She's a new employee here at IRHA to help support the efforts of reducing the infant mortality numbers here in the state of Indiana. And when House Bill 1007 was introduced, it was done so with the support of Dr. Box, our state health commissioner, and she actually mentioned a number of times the efforts being put forth by IRHA through this grant to help address that. Representative Kirkoffer from the House actually was the author on House Bill 1007 that ultimately requires ISDH to establish a perinatal navigator program and to use an evidence-based assessment with regards to substance abuse in pregnant women. I want to make clear that this bill is not putting women who are pregnant at risk for being arrested. This is to provide services to come alongside of those women who are struggling within their pregnancy with substance abuse so that they can get very needed wraparound services so that not only their child, but their unborn child, but them as well can get some care and attention, hopefully address some of the challenges and strife in their life to help get them and navigated back onto a road of recovery. We were really excited to see Dr. Box and Representative Kirkoffer, take this and run with it. And this bill was signed on the 8th of May up in Lake County. And for those of you who are following the infant mortality numbers, we know that it's not just a rural problem or a rural challenge. It is something that we see regardless of the setting. So excited to see the various programs and support that our 92 counties are going to see within this endeavor.
Okay, good. Thank you. How about if we go down to 1015?
1015. Oh, I'm moving too fast, Jim.
Oh, you're fine. Okay, 1015. I mentioned earlier about the various gaming matters, or what some folks will call an expansion of gambling in the state of Indiana. And it's my it's my understanding, and I believe this is still the case, that gambling is the third largest industry in the state of Indiana in terms of generating tax revenue for the state, which, if you think about it, is a pretty significant amount. And there was a editorial cartoon the other day in the Star, Indianapolis Star, that basically showed some guy. It looked like it was kind of a spoof on the opiate crisis. It was the General Assembly. He was the man who was taking a shot like he was a heroin addict. He was giving himself a shot, and the syringe indicated gaming revenue. So the cartoon would indicate that the General Assembly and our legislature is so dependent on gaming revenues to help fund some of the programs within the state of Indiana that we can't turn back the clock from 20 years ago when gaming first was started with some of the scratch-off games with the Hoosier Lottery. Nonetheless, in modern day, Public Law 293 does address some of the issues and some of the changes that will occur regards to the two casinos up in Gary, one of the purchases of the license in Terre Haute, and the expansion of sports gaming and betting throughout, not just in Indiana, but throughout the country as a result of the last year's Supreme Court decision. So that was 10-15. How about 12-11? Right down there. I made a comment earlier about what's transpiring in Alabama, some also very restrictive legislation in the state of Texas. This 12-11 for abortion matters was a pretty controversial bill that the governor signed at near the end of the session, which has to do with a level 5 felony for a practitioner knowingly or willingly performing an abortion unless basically the mother's life is at risk or in serious health. Now, serious health probably will end up in court defining what that means. You would assume at some point that'll probably end up in court to define what that means, similar to what the courts often have to define what is reasonable. So I think there's going to be more that will occur, or stay tuned on the result of House Enacted Act 1211 and what could occur in the courts as a result of the adoption of this particular bill. All right, let's move on.
Before we do move on, really quickly, Jim, I just want to call everybody's attention to Bill Watch 1200, which is the telepsychology bill that was signed by the governor on April the 29th. And it was a bill that was brought forward. I think it had a couple of uses or a couple of intents when it was put on the slate. Right now, there's, as many of us know, there's still a stigma around mental health and seeking support when you are in need of mental or behavioral health. And as we all know, telehealth and telebehavioral health are starting to become more widely aware. Our constituents are more aware of what that looks like. Our schools are starting to utilize it in their school-based clinics. And I think the bill really came alongside to give people comfort that should a psychologist use telehealth to execute a visit, that they are going to be using confidential communications. And that means that the server that they're coming across or the records that they're maintaining are all HIPAA compliant, whether that be cloud-based or location-based. And that folks who are opting to utilize telehealth or telebehavioral services can do so with an understanding that it is being held with the utmost confidence in doing so.
Okay, thank you. How about for the next one that the IRHA supported, 1344?
Sure. So those of us who have worked in healthcare for a number of years have been aware of a nurse licensure compact, which I believe was being executed in 33 or 34 states. Indiana had been remiss in participating in that. But as we are seeing baby boomers opting to retire and leave the nursing profession, it was imperative not only for our hospitals that are executing on the periphery of our state, but just as a whole, for us to be able to have a deeper well with which to draw nurses from to come in and work in our facilities. So through this law, it will come into effect July 1, those 33 other states that nurses are now connected in, if somebody wants to come into Indiana and they want to work, they no longer have to file for an independent Indiana license. They will be able to drive their license through this compact and come to Indiana to work. So I'm thrilled to see this. I'm sure that this is providing some folks a bit of breathing room, knowing that their pool of nurses just became that much larger to draw from.
Good, thank you. Just scoot down right below nurse license. Yeah, the next one should be. Yeah, there you go, the next page. Okay. I mentioned at the outset there was discussion about medical cannabis and also CBD oil. You can see some of the action that took place there at the top. If you go back down one, Deena. I think it's 1444. There you go. Yeah. A study committee on taxing CBD oils. Notice that it got through both chambers, but they could not agree to the final language in conference committee. So it failed and never got fully adopted and was presented to the governor. But clearly there's discussion and concerns about how to regulate and tax the CBD oils. And I mentioned earlier the store that's on the Hamilton-Boone County line. They'll be looking at how to study at some point how to do the taxation on that particular oil. Medical cannabis, 1535. It didn't get out of committee, but there was discussion in one of the committees, at least talking about medical marijuana as a treatment plan and a treatment program, which was unheard of in this state even 5 years ago. So the fact that it even got a hearing was pretty remarkable.
I agree with that sentiment.
It's truly remarkable. Now, that's strictly for medicinal purposes, certainly not for recreational purposes. And the governor has come out strongly in opposition for certainly the recreational use, but he's also come out in opposition from a medical perspective. So you doubt, or you certainly would doubt that it would have any action as long as Holcomb is in office. How about, Deena, tell about 1548 Medicaid managed care matters?
Sure. So this was brought forward by Representative Cindy Kirkoffer. This basically provides that the Medicaid Oversight Commission will prohibit state Medicaid from denying or decreasing payment for medically necessary service based on lack of eligibility or coverage if the provider meets certain criteria. And this really just goes to reinforce that folks who are the most susceptible, who are the most vulnerable, will have access to care, and that Medicaid can't step in and say, well, we've decided. That language I don't think is going to be heard.
Okay, thank you. And then the last two that are on this same page that you're looking at now are 1551 and 1565. Obviously, we have some people on this call that have particular interest with tobacco issues. Both of these, raising the tax for tobacco and raising the age for use of tobacco, both of these died in committee and never really got a hearing at the Public Health Committee. Need anything you'd like to add?
I say this, and we hear it oftentimes. For those of us who work in healthcare and live in rural, you understand what the challenges are, what ultimately happens when a young person starts smoking, and what that effect it has on establishing or supporting other comorbidities coming into play within that individual's life. And I will just say, have conversation about what that means with the legislators that live in your area. Most legislators do not have any healthcare background. They do not understand the word comorbidity or the implications that come from what happens to an individual if you have two or more. They do not understand the implications on the budget that they so diligently work on when an individual has two or more comorbidities. And so education is imperative to getting more of these folks on board with regards to raising the tobacco tax and raising the smoking age from 18 to 21. It really just comes back to making sure we're talking about how this ball starts and how it morphs into something that's really out of control and extremely costly for Indiana taxpayers, and that's really the crux of the conversation.
I want to thank Kathy Walker for her comments regarding vaping and some of the issues that were addressed during the session regarding vaping. Deena, I think you kind of touched a little bit on some advocacy and how to advocate your positions with your various legislators. Is there anything else you'd like to add to what you already stated regarding their lack of familiarity with healthcare issues?
You know, if there's concerns that you have about what to say, whom to say it to, how to address the challenge, certainly let me know, bring it to my attention. If I don't have resources for you, someone on the IRHA staff would. I know it is now 1 o'clock. I'm going to drag my screen over here really quickly. Here is the Indiana General Assembly homepage. If you want to find your legislator, please, here's a great way to do it. I plugged in this information earlier. It's not hard. It will actually populate for you and tell you who those individuals are. I used our home office information to plug this in. These links are hot, so it gives you information on how to contact them, tells you what party they are. Down below that is your federal folks. If you're not sure how to get in touch with them, here's their phone number. You can also go to the governmenttrack.us for Congress members. Here's the state of Indiana. Here's our little outline. I happen to live in District 5. I can click on the District 5 map. Maybe it'll populate. So it's going to tell me that my senators are Todd Young and Mike Braun. Here are the 9 representatives out of Indiana. Blue, of course, is the Democrat. Red would be the Republican. And when you click on them, so I'm going to be in District 5. Susan Brooks happens to be mine. You can see here where and how some of what Susan is doing, the committees that she sits on, her current legislation, and bills that she's sponsored. We would be happy to support any efforts that you're looking to engage with these folks. Please don't hesitate to reach out to us. It's really important that they hear from folks who are living and working to understand or to better understand what it is that we're trying to navigate here in the Hoosier State.
Okay, thank you, Deena, for that detail. That was good. At this point, I think we've concluded our program. I guess we could open the floor if anybody had any questions at this time.
If anybody doesn't have questions, or while they're contemplating what questions they might have, just really quickly, Allie's put a link in the chat box with regards to our post-session survey. I would encourage those who participated today to please participate in that. We would love to have feedback. If there's anything that you find that you'd like to have further dialogue with, please contact or reach out to Jim or I. We are always happy to discuss things with you.
Thank you both. We'll go ahead and conclude this session. And again, if you need to contact Jim or Deena, I believe they shared their contact information earlier in the chat function. Just really appreciate everyone's time today. We have recorded today's session to make that available to you or anyone you would like to share that with. Thank you.
Thank you, folks.